What we can do to reduce the odds of burnout for all of us, but especially in healthcare workers. Joining us now to talk a little bit more about this, Janet Wray with Mount St. Joseph University. Good morning to you.
Good morning, Liz.
So tell us just a little bit about what you do there.
Okay, so I've been teaching nursing for many, many years, and I teach primarily psychiatric and mental health nursing, and my specialty within psych mental health is addictions nursing.
Wow, so what an interesting field and what an interesting time.
Yes,
huh?
it is.
Yeah. So I'm curious, first of all, what you're seeing or hearing about burnout. Like, we've even wondered, is it influencing enrollment into nursing programs and things like that?
Yeah, that many facets to that. First of all, just to let you know, we were struggling even in 2019 before the pandemic. Nurses were under a lot of stress even then. And the American Nurses Association started an initiative called Healthy Nurses, Healthy Nation to try to address this issue, because they found that a lot of nurses were not very healthy. And so if nurses could start paying more attention to their health, then they would be good role models for their family and for the patients. So that's before COVID. Then we have COVID and the pandemic, and it was like a huge car accident that hit the United States all at once. And nurses particularly, because as you know, nurses are the ones who are taking care of the patients at the bedside. And so it's really created a lot of stress for nurses, and we're concerned. We're seeing nurses leaving the profession at a time when we need them more than ever. So we've got our work cut out for us.
Yeah, lucky we have people like you who are trained in this. We do have a little video of just kind of this pandemic and the role that nurses are playing in that kind of thing. So let's start with the basics. Are there early warning signs that we should all be paying attention to sort of support each other?
Yes, I would say that's the most important thing, is to take a good look at ourselves. The most unhelpful thing you can do is to do nothing at all. The next most unhelpful thing to do is to turn to unhealthy means of coping with stress. So drinking alcohol, using medicines when they're not prescribed, smoking, too much coffee, that is not helpful. The next thing I want to say is that it is normal to feel overwhelmed in this time, and it's imperative that people ask for help. If they find that they're out of control, try to identify what areas you're out of control, and it is a sign of courage to ask for help. So that's the main thing. It's normal, it's a normal response, there's help available, but we have to be upfront about that and ask for that kind of help.
You know, that's really well said, because I think when you're the helper, it's very hard to reach out for help. You gave us just some ways to recover that were a little bit healthier than some of those other things you mentioned. And so we want to just put up a graphic for you and have you talk us through these. These sound like common sense, but you know, my mom was a nurse and she said you're working all kinds of shifts. Everyone brings you candy. You're lucky if you can get regular meals. It's easy to say these and much harder to do that.
Yes, that's right. So let's just start with that first one, activity. We know that exercise is not only good for our bodies, exercise is also good for our minds. And we also know that getting outside seems to have a greater benefit than exercising in a gym. So even if you can just take a 10-minute walk outside once a day, start small, pick something that you can do and something that you have an interest in. If you've never been a person who's gone to the gym, this is probably not the time to try to do that. So
you know, one of the things I often talk about, I'm a dietitian by trade, is that, you know, when to do those things, you have to give yourself permission to take care of you. And I think, I'll say as women, but I'll say especially when you're a woman that cares for others, or even a guy, you don't think of you as having time to do that, or you're not, you know, somebody that needs to go do this. You have to take care of everyone else first. But really, isn't a lot of that saying you can take the time to go outside and go walking and it's not selfish?
You know, and I want to say that nurses and anybody in healthcare does not want to be told what to do.
That's so true.
We don't want to be told what to do. So I guess what I'm saying is I'm giving people permission to do these things, not telling them to do it. And you're right, you know, we are so busy taking care of others that sometimes we neglect ourselves. But this is a time when we can't afford to do that because so many people need us to stay healthy. And so, yes, I'm giving you permission.
Yeah, boy, that's well said. Okay, couple things we just want to leave you with. You said if you've done those other things that are sort of physical, there's some emotional things that you want us to do. You want us to connect. You want us to sort of pay attention to what we're feeling and talk to others. Easy to say, hard to do again. So real quick, how do you tell people to sort of start this process?
Okay, first of all, when I say connect, it's not social media. So it's imperative that you spend time with people.
Yeah.
So that's number one. And then take notice means being in the moment. So being present. We know that being present helps us just to calm down. I already talked about being active. And then when we learn, we are open to new things and we find wonder, and that helps our self-esteem.
Yeah.
So keep learning.
And I also think that learning involves a change in behavior, so you know that we've actually learned the importance of this and we start doing something else. Thank you for coming today and just helping us to give ourselves permission. I mean, we're all feeling it in some way or another.
Thanks.
And thank you for what you do. If you'd like to reach out to the nursing team at Mount St. Joseph University, we have their wonderful School of Nursing and much more at whatshappeninginhealth.com. Janet, thank you.